I've been approached recently by folks who've been asking about why Inova is developing so actively the Inova Health Plans division of our activities. Like a lot of things, resources are tight and we're working very hard to try to improve our affordability. And a lot of folks have said, why are we investing in insurance companies or in health plans? Thought we were healthcare providers, not insurers. How does that figure into our future? Why is it important? Well, I think it's extremely important that we invest in health plans, and as you may know, we've created a joint venture for the commercial insurance market. We've created in Total Health, which is we purchased a plan that will be targeting Medicaid, and it won't be long before we will be launching a couple of new products related to Medicare patients. Why is that important? Well, embedded in the Affordable Care Act is a set of regulations and rules which basically nudge the healthcare system toward operating on a new economic incentive. And the new economic incentive really is to pay global payments to health systems like Inova. And that economic approach basically says the more you can keep a person healthy, the more you can keep them out of the hospital, the more you can manage their chronic disease so that they don't have to go to the doctor, the emergency room, much less be admitted, then the more economically you will be rewarded. Well, while a lot of folks are in accidents or become ill and we seek to restore them to good health, the reality is that the bulk of folks in this community and your family and mine are not actively sick. And if we're going to be paid in the future to keep them well and to keep their health status high and away from the healthcare system, health plans are a way of economically organizing to do that. So health plans provide the infrastructure to manage chronic disease and maximize quality of life, to keep people with flu shots and vaccinations, all the things that keep them from getting sick. They basically organize networks of providers like doctors and hospitals and clinics and home health and all the other components to basically return people to health and functionality in their job and their work and their school as quickly as possible. All that's a good thing for patients. All that's a good thing for communities. And with the economic model rewarding folks who are doing that well, Inova having health plans empowers and enables us to actually be economically advantaged by doing what our mission says we really want to be doing anyway. So health plans are a critical part of our future to make Inova sustainable, to make our patients' quality of life the best it can be, and frankly to keep as many people healthy and out of the healthcare system, because that's really where they want to be, enjoying life, doing well, pursuing their personal goals. Health plans help make that possible. Health plans are a good part of Inova's future.
Today we're going to talk about the modern healthcare system in the United States and get a history and timeline of how we got to where we are today. In 1901, the American Medical Association becomes a national organization. Membership goes from about 8,000 physicians in 1900 to 70,000 in 1910. This is the beginning of organized medicine. Doctors are no longer expected to provide free services to all hospital patients. The Depression in the 1930s changes the country's priorities to a greater emphasis on unemployment insurance and old age benefits. The Social Security Act is passed, but doesn't even mention health insurance. In the 1940s, penicillin becomes widely used and has a dramatic effect on the leading cause of death at the time, infection. During the Second World War, wage and price controls are placed on American employers. To compete for workers, companies begin to offer health benefits, giving rise to the employer-based system we have in place today. President Roosevelt asked Congress for an economic bill of rights, including the right to adequate medical care. By the 1950s, more medications are available to treat a range of diseases, including infections, glaucoma, and arthritis. New vaccines become available that prevent dreaded childhood diseases like polio. The first successful organ transplant is performed, and the price of hospital care doubles because of all of the new services. In the early 1960s, those outside the workplace, especially the elderly, have difficulty affording insurance. President Lyndon Johnson signs Medicare and Medicaid into law. The number of doctors calling themselves specialists grows from 55% in 1960 to 69% by the end of the decade. By the 1970s, healthcare costs are escalating rapidly, partially due to higher than predicted Medicare costs, along with rapidly rising inflation. People are living longer with the greater use of technology, more medication, and a growing list of expensive, cutting-edge treatments. People start to question if the American medical system can sustain itself with the rising costs. In the 80s, corporations began to integrate the hospital system, previously a decentralized structure. Overall, there's a shift towards privatization and corporatization of healthcare. By the 1990s, healthcare costs rise at double the rate of inflation. In the 2000s, healthcare costs continue to rise, and Medicare is viewed by most experts as unsustainable for the coming baby boomer population. Premiums going up by double digits each year, along with the aging of the workforce, lead many to believe that health insurance through your employer can't last. Direct-to-consumer advertising for pharmaceuticals and medical devices begin to engage the consumer in the process. The internet begins to put quality medical information in front of consumers, both from news sources like WebMD and trusted centers of excellence like the Mayo Clinic and others. By 2010, Facebook, Twitter, YouTube, and other social networking sites continue to revolutionize communication. Consumers go online to learn about everything, including their health. The passage of the Affordable Care Act makes major changes to the future of care, putting more emphasis on prevention and detection. In 2012, a Silicon Valley doctor launches Step 1 Health, an easy connection to new healthcare. Step 1 Health is a digital starting line that allows consumers to be proactive, informed, and in charge of their healthcare decisions. Step 1 Health combines easy access to early detection and prevention with a community of connected people, changing the healthcare experience. The Step 1 Health consumer experience starts with a free private health record, or PHR, where detailed lab results answer the question, what is my health like today? The private record then connects to the tools and people who are waiting to help. Working together in a community, everyone can make informed decisions and track changes in his or her health over a lifetime. Because knowing your numbers is where you start, the first Step 1 Health partner is MyMedLab. MyMedLab is a leading provider of direct-to-consumer laboratory testing services. MyMedLab will provide all eligible Step 1 Health members with a baseline panel of 65 different tests with no out-of-pocket expense. Members can determine if their health plan qualifies for the free benefit by going to step1health.com. Those whose health plans do not cover the cost can purchase the same benefit for a discounted price. Understanding your health improves the quality of life for you and your entire family. Joining Step 1 Health as a family and creating a private health record for each member of your family encourages healthy habits that last a lifetime. Step 1 Health membership is free for everyone. To get started, visit step1health.com.